Well, good afternoon, everyone. Another week has passed without any new cases of coronavirus or COVID-19. We are getting used to our new normal and life goes on as much as it did before. Routines have resumed, children are back in school, sports fixtures are on the calendar. Diaries which have been blank for months are starting to fill up as we make our plans again. And others are doing the same. Yesterday, Scotland's First Minister, Nicola Sturgeon, described the relaxation of COVID measures there as the biggest step so far in exiting the lockdown. It is indeed a big and tough decision. We too agonised over reaching that point. But time marches on and it feels strange watching cautious steps being taken across in the United Kingdom when we have had most of our freedoms for some time ago now. The comparison between us and our neighbours highlights what a remarkable position we are in and reminds us we must not let complacency set in. One thing that we all share is the long and difficult road ahead to repair the economic damage wrought by COVID-19 across the United Kingdom and here, and I will return to that theme later. But before I do so, I will now hand over to the Health and Social Care Minister, David Ashford, for the latest numbers. David.
Thank you, Chief Minister. The total number of tests undertaken stands at 7,430. We were awaiting the return of 34 results, so the total concluded tests now stands at 7,396. The total confirmed cases remains at 336, meaning we have no new cases identified. Thank you, Chief Minister.
Okay, thank you very much, David. Now, last week I reflected on the vast sums injected into the United Kingdom economy by Chancellor Rishi Sunak in his summer budget update. Committing $30 billion to nursing the economy back to health is a bold step. It is designed to bolster confidence, encourage spending and avoid a tide of job losses. Such measures take time to produce results, and official figures continue to expose the severity of the situation on a regular basis. Today we saw news that the number of workers in the United Kingdom payrolls fell by almost 640,000 people between March and June. The total hours worked in that period dropped to its lowest level since 1971. United Kingdom job vacancies are at a record 20-year low. And the full effects of the pandemic on unemployment will not be known until the United Kingdom government support schemes come to an end in October. As I've said before, United Kingdom figures do not bear comparison with our own, but like our friends across the water, the Isle of Man is not out of the economic woods. Yes, our economy has started to pick up more quickly than we expected, but we must be realistic. We need sustainability in the long term. As our sectors open up, they are finding trading conditions have changed, more cautious. Our approach to navigating the challenges will be outlined next week in Tynwald when the Treasury Minister provides his budget update. This will include a comprehensive appraisal of the Isle of Man's economic position following our sudden and swift response to the pandemic. Minister Cannon will outline the impact that this and the six-month reduction in VAT in the tourism and hospitality sector may have on the public purse. Not all businesses will be able to adapt to the new economic realities. We have to accept that the unemployment rate is likely to rise. We know that the health of the economy determines the scope for public spending. So next week's budget update is relevant to everyone. Economic forecasting is difficult at the best of times, and at the moment is doubly so. We are, as it has been said so often, in uncharted territory. If the determination and resolve of our people alone could fix things, we would be home and dry. But we do not know how hard we will be hit by global factors over which we have no control. The stakes are high, and I'm sure we will have a lively debate in Tynwald after Minister Cannon gives us his situation report on the economy. I look forward to hearing the views and contributions of my Tynwald colleagues, and I will be keen to hear what you, the Great Manx public, think about it. The changes to our border post last week are almost upon us. From next Monday, Manx residents will be able to leave and return to the island for non-essential reasons. Travellers will need to obtain a Manx entry permit and a landing form. These documents are a legal requirement for anyone wishing to return to the island. They will be available via online services on the government website gov.im, and the registration process is due to go live tomorrow at midday. Now, if you don't have access to online services or you want advice, then please call 687 171. Now, the entry permit and landing form will confirm your Manx residency and will tell us where you intend to spend your 14 days of self-isolation on your return. It is of paramount importance that everyone intending to return to the island knows exactly what the rules are. I know that a fortnight in self-isolation is a substantial commitment. It is not one that anyone can take lightly. All sorts of things need to be considered, from food, shopping to walking the dog, and much in between. This will need careful forward planning, especially for those who will be living alone on their return. Self-isolation means what it says, not leaving your place of residence for 14 days in line with the guidance. As I've mentioned before, there will be checks by phone and in person to ensure that everyone is following the rules. Clearly, self-isolation will be more of a challenge in a small home with others living there than in a larger house or for those on their own. Only the traveller has to self-isolate. Other occupants are not confined to the house, but must do everything possible to stay apart from the person self-isolating. That means being in different rooms at all times, and where kitchens and bathrooms are shared, it means using them at different times and ensuring facilities are thoroughly cleaned in between. Now, this goes back to the strict regimes we put in place at the start of the pandemic. The government website has updated guidance themselves. Self-isolation is our key defence against a fresh outbreak of COVID-19. If anyone returns from the United Kingdom carrying the virus, they probably won't know about it. Isolating at home for 14 days is how we stop it spreading. Self-isolation is an effective weapon. Now, we can enjoy greater freedom and continue to protect our most vulnerable people by acting responsibly. So to all of those planning to head off, please make sure you understand what is expected, follow the rules and prepare in advance for isolating when you get back. Now, I've deliberately laboured the point. We are taking quite a significant step in relaxing border restrictions. We've done it for entirely positive reasons, to help those who have waited patiently for the chance to travel off island. And I should say that the rules just outlined do not apply to visitors from Guernsey. We've created an air bridge with Guernsey because both our islands are COVID-free. That is why it is safe to visit each other without the restrictions we have put on travel to the United Kingdom and beyond. Both the Isle of Man and Guernsey are maintaining border restrictions for non-residents, a policy which has worked for both of us. And I look forward to welcoming the first visitors from Guernsey, and I'm confident this unique partnership, born from extraordinary circumstances, will be a success. And now to questions from the media. And first we have today is Jess Ward from Isle of Man newspapers. Good afternoon, Jess. Faster Mai.
Faster Mai, Chief Minister. Just touching upon Guernsey, it has been reported that Guernsey has entered talks with Iceland about opening an air bridge between the two, but Iceland currently has active cases of COVID-19. Surely we need a joint air bridge policy with Guernsey. What is the government doing about that?
Well, I am having weekly meetings now with the Chief Minister, Gavin St Pierre, of the Chief Minister of Guernsey. I should have had one yesterday, but sadly our diaries didn't allow it. We both had commitments, so I'm speaking to him first thing tomorrow morning, and we will be having regular updates on their policies. We've always said that if they make any changes or we make any changes, they will let us know, and our respective public health teams will be speaking to one another to ensure that whatever changes are made, that we are both comfortable with those decisions. Now, they're currently looking at Iceland, but it may well be some time, and we'll obviously have to have those discussions with them. So I've always said that Guernsey may well be the first air bridge, but it could well be that other jurisdictions come into this area, and we'll just have to monitor that, Jess.
Okay, thank you. My next question is for the Health Minister, please.
Afternoon, Jess.
Hi. Where are we up to in terms of health services being open to the public, with residents being able to meet with health professionals face to face, specifically in relation to GPs, dentists, and opticians?
So in relation to the dentists are now open for appointments. You've got to pre-book the appointments. You can't turn up and book an appointment at the moment. But the dentists do still have some self-imposed restrictions. But basically the dentists have moved pretty much back to normal now. Obviously people do, though, need to be aware that because of the cleaning regimes the dentists have got to put in place, there will still be limited appointments for the foreseeable future. So it's not completely back to normal, and the dentists will obviously be prioritising urgent cases over routine. In relation to optometrists, we've been working with them in order to get them back open. We've drawn up basically a standard operating procedure for them to use. In terms of the clinics, in Nobles, they are returning to normal as well with face-to-face appointments. The GPs, in terms of triaging, are continuing to do telephone and video triage where they believe it's appropriate. But one of the things I need to emphasise with the GPs, of course, is they never did actually shut down. Where the GP felt someone needed to be seen face-to-face, that continued through the pandemic period. In terms of our elective surgery, we're just in the process now of restarting the elective surgery. There will still have to continue to be swabbing of patients prior to them undertaking surgery, and that process has had to be put in place first. But we are now opening up all the facilities across the health and social care.
Okay, thank you very much, Jess. We'll now move on to Rob Pritchard from 3FM. Good afternoon, Rob. Faster Mai.
Faster Mai, Chief Minister. My first question is for the Health and Social Care Minister, please. I just wondered when we will get the next update on the antibody testing programme and what's coming from that.
The plan, Rob, is for tomorrow for us to get the interim report out. Or I should say it's an interim report, because it will only cover the first 3,800 tests which have been done at the point we started collating the data together. But we should be able to get the findings for that out tomorrow.
Thank you very much. My second question is to you, Chief Minister. We mentioned before about the air bridge opening with Guernsey next week. I just wonder what progress has been made with securing other air routes in the long term as the borders gradually reopen over this unspecified amount of time.
Well, obviously, Guernsey is the test. If that works well, then we'll be able to look at other places. Obviously, if you look in the island of Ireland and Southern Ireland, I think out in the rural areas, there are quite a few areas where they've got no cases of COVID-19. But they still have some elements in Dublin itself. So we're monitoring other jurisdictions to see how their situation is with no cases at this moment in time. Guernsey is the only jurisdiction we're looking at. I'll obviously be discussing with the Chief Minister of Guernsey regarding Iceland, but as was earlier said, they still have active cases, and we'll just have to monitor that. So we're still monitoring the situation. But it has to be safe. There has to be economies of scale to make sure if these travels will work. It just so happens that Guernsey have their own airline sitting there, and they have no cases and we have no cases. But I'm open to looking at other jurisdictions, but they must be in a good position before we would consider freely travelling there without having the restrictions of quarantine coming back. And I think that's the key area, isn't it? It's the days of isolation that you've got to quarantine, you've got to do when you get back. Is that okay, Rob?
Thank you very much.
Right, we move on to Chris Cave now from Energy FM. Chris, good afternoon. Faster Mai.
Good afternoon, Chief Minister. My first question is for the Health Minister as well, and it's really building on a question you've already answered this afternoon, but could you please give us an update on Nobles Hospital? Are there still wards shut? Are some theatres still set out which limit the number of surgical procedures that can be carried out and therefore increasing waiting lists?
The wards have been reconfigured back within the main Nobles building. Obviously, we still have the COVID ward that was outside the main Nobles building in the old Ward 20 in Wood Newlands. That's still there. But the main wards, the two COVID wards, have now been converted back to normal wards. In relation to the theatre, one of the theatres was turned into extended ICU capacity, and that has now been converted back to theatre as well. So in terms of the situation within the main Nobles Hospital, it is basically pretty much back to normal now.
Okay, thank you. And my second question is for you, Chief Minister. If there is a second wave or a serious spike in cases across in the UK, will we see travel restrictions here re-implemented as they were? Obviously, a lot of people are looking forward and hoping that the number of cases in the UK continues to decrease. But if that isn't the case, if we do get a second wave, will we be seeing those travel restrictions here re-implemented?
Well, I suppose it all depends, Chris, on the severity of it. We have issued guidance to everyone on the island about our stages if we get a second wave on the Isle of Man. And at some stage, we have to concede that we will have the odd case on the Isle of Man where people come back unbeknown to them infected, but because of the 14 days isolation, we will stop that from spreading around the whole of the island. So we have got the different stages depending on the number of cases on the Isle of Man. Obviously, if you analyse the UK spread, if there is a significant second wave, because they're only probably looking at, I don't know, 3-4% infection rates amongst their population, so there's still a significant amount of the population haven't had COVID-19, then obviously we will take action. But obviously it's, you know, there's no tablets of stone. I sincerely hope the UK carry on their downward trajectory of the number of cases, but we are constantly monitoring that, Chris, and our public health team have daily conversations with the United Kingdom public health team to compare notes and numbers.
Thank you.
Thank you very much, Chris. Now we move on to Josh Stokes from ITV. Josh, good afternoon. Faster Mai.
Good afternoon, Chief Minister. From next week, there will be some people travelling to the UK and back to the island, but some may need to leave to go to the UK again within the 2-week time frame for isolating, maybe for work, for example. Are there any rules currently in place for those people? Are they allowed to leave again?
Well, we've never stopped people who've come over to the Isle of Man. We've never said you must stay here for 14 days. If you are going straight to the port, whether it be the airport or the harbour in Douglas, then you can go. What we'll be advising is that, and David might want to touch on this, is that we'll be discussing the wearing of masks for those people. I don't know, David, if you want to expand on that, please.
Yes, happily, Chief Minister. In terms of people leaving during the self-isolation period, the rule is exactly the same as it was throughout the entire pandemic. There is nothing to stop someone doing that if they wish to leave, but they must travel from self-isolation directly to the port of exit. One of the things we have been discussing is that they should also wear masks and take appropriate PPE in order for them to travel back out because of those around them.
Okay, just supplementary to that, and obviously masks is something we've been discussing over the whole pandemic, and it's always been said, you know, that it's advised, but it's never been regulated. Why the change now?
Well, it's not actually a change, Josh, because it's exactly in line with what we have already we've said, and our mask advice that is out there at the moment, which is a mask does not protect the wearer. But what it does do is it has some low-level effect in protecting those around the wearer if the person is asymptomatic. And that's exactly in line with that advice. Anyone who's leaving self-isolation early wears a mask to exit the island.
It could well be that they've gone away, they've come back to the Isle of Man, they've maybe caught the illness, worst case scenario, but they're not exhibiting signs and they could be infectious leaving the island. So we feel that the wearing of masks, as the Minister said, doesn't stop you catching it, but it can reduce your infection to others, and therefore that's what we, as I say, we've been doing for a while now.
Okay, thank you. My second question, in regards to the air bridge coming in next week, is there a procedure in place for if a Manx resident catches COVID in Guernsey, and likewise if a Guernsey resident catches it here, are they sent home? Do they isolate where they are? And is there any agreed procedure in place for that with the Guernsey government?
Right, I'll let David answer that, if that's okay, David.
In terms of that, Josh, it would depend upon the state of the person. Normally, the person would be expected to self-isolate where they are. That is normal routine procedure. So, for instance, we've had that in the past with cases of Manx residents in the UK who may have shown symptoms. They should not travel with symptoms because they've run the risk of spreading it. If it was someone who obviously was in medical difficulty, then there would arrangements need to be put in place to transfer that person back to their home jurisdiction between the two governments. But the person should self-isolate where they are for the 14 days until they recover.
Very much, Josh. We now move on to Amanda Cashmore from Gef the Mongoose. Good afternoon, Amanda. Faster Mai.
Faster Mai, Minister. My first question is for the Health Minister, if that's okay. The Oxford University vaccine is so far showing promising results. There is hope that some could be available by September, and the UK government has agreed to order up to 100 million doses if the trial is successful. If there was to be a viable vaccine by then, would the island be allocated vaccines, or would we be at the back of the queue?
We most certainly would not be at the back of the queue. We've had talks with the UK government and my equivalent department, DHSC, in the UK. They have made absolutely categorically clear that via the NHS supply chain, we would be able to access the vaccine. We would be prioritised in the same way as any other part of the UK would. So we'd be treated exactly the same. The Oxford trial is looking exceptionally promising because the most recent data, of course, from that trial is suggesting that it's not just triggering an antibody immunity response, but it's also potentially triggering a T-cell response. It's still early days in relation to that, but there is growing confidence around the Oxford trial, and in relation to that, the UK government have made quite clear we would be prioritised in the same way as any other region of the UK.
And just to build on that, if that's okay, it looks like it possibly could see 30 million doses in September in the UK. Do you know what portion of that we would have on the island?
It would be done on a population basis, so I haven't got that exact figure in front of me, but we would obviously negotiate with the UK based on our population for a share of that, and they have guaranteed that we would get a share of that. What we would then have to do is we would look obviously at the most vulnerable categories in our society to prioritise who in the population requires the vaccine the most.
Okay, thank you. And secondly, my question is for you, Chief Minister. We've previously discussed testing arrivals upon entering the island in a bid to cut down on quarantine time, as this has been introduced in other countries. If this was to happen for every arrival, would the cost of testing be too high, and would you consider asking travellers to purchase their own tests?
Well, the cost of carrying out the test is expensive, Amanda. I mean, we've come to the conclusion that so far, with the 14 days quarantining, it's not worth the cost, and B, taking trained staff away from working in Nobles hospitals to do the test on people, because if we find someone with COVID-19, we're going to make them isolate for 14 days, which is what they've got to do anyway. Now, what we are obviously closely monitoring is the Guernsey trial, which finishes this week, where they are making people self-isolate at home for 7 days, and then on the 7th day they are going to test the people, and that's the choice of the person. They can be tested, or they can continue to self-isolate for the 14 days, and if they have a test and they come back as negative, then they're allowed to walk around Guernsey, but they're not allowed to go into restaurants, into cinemas and theatres, anything where there's an enclosed number of people. So obviously we'll see how that data works. They reckon that will catch now up to 85% of cases, so we'll have to monitor that. But as I say, the tests are not cheap. If we've just been discussing a paper in the Council of Ministers for having to test everyone before they have an operation or go into Nobles Hospital for a procedure, and we are talking a significant amount of money. So doing tests at the border now, to me, at the moment in time, is not the best way of spending our money, when we are going to ask people, even if we spot it, that they've got to isolate anyway for 14 days. So obviously you never say never. If a new test comes along that catches the person, definitely that they have COVID, irrespective of whether it's showing itself or not, then that's a game changer. But at this moment in time, we don't have plans to do testing at the borders. But as I say, that's never say never, maybe in the future.
Just to go back to my original question there, though, if you were to go on to testing at the border, would you ask people to purchase their own tests?
I think that's something we would have to look at, because obviously there's a cost to the taxpayer, and if you choose to go away, then you are causing the taxpayer on the Isle of Man to have to fund that. So it's obviously a debate we'll have to have, but I think if it's £20-30 a person, then it might be reasonable to ask people to contribute towards that cost, because it's their choice to leave the island.
Okay, thank you very much.
Thank you very much, Amanda. Right, we now move on to Simon Richardson from Business 365. Good afternoon, Simon. Fast am I.
Good afternoon, Chief Minister. Still on a travel theme, Terry Lydiard, the former boss of Manx Airlines, has said he believes the time has come for the Isle of Man to possibly establish its own airline, given the many potential difficulties in attracting operators to our routes at the present time. Do you agree with him, and could his expertise be used to bring about a new national airline for the Isle of Man?
I don't agree with him. I do agree that it may well be the case that we have to look at underwriting an airline company's flight. So if we want a company, say, to go to Birmingham or Bristol or Dublin, and the cost of the flights aren't being met by the number of passengers, then to guarantee those flights continue, we say, right, if it's shy, if at the end of the year you haven't covered your costs, we will pick up the tab, then that might be something we will have to look at for the next number of years. If you analyse Warren Buffett, the well-known investor, he has pulled all of his investments out of travel for the next 5 years. He's saying he can see the returns on capital for him aren't going to be good enough. So that may happen. But if you look at our good friends in Guernsey who do have their own airline company, I think in a good year they've been losing £10 million, and figures are being bandied around that there might be £30 million losses this year as a result of COVID-19. An airline company, the taxpayers would not be impressed with that sort of loss. So underwriting flights from existing companies, and there's plenty of people who are prepared to come into the Isle of Man to do that, to me is a way forward if we have to do that. But again, it's something we are aware of. The open skies policy has served us well up until now, but a totally different situation has arisen, and we've got to review and decide what the way forward, because at the end of the day, connectivity for our people and for our businesses is really important to enable them to get to business meetings or to see loved ones around the world. And your next question, Simon.
Thank you. My second question, the UK recovery looks set to be long and painful. And as our major trading partner, is this of great concern in respect of our own road to economic recovery?
Yes, absolutely. I think I'm on the record as saying we're probably about 80% of our trade is with the United Kingdom. So whilst we might be in a good position, we're seeing the green shoots in our own economy. I've always said it's events that happen off island that have the biggest impact on the island, and that's why I spend so much time in Westminster meeting with relevant organisations to make sure that the Isle of Man's views are always known to the UK government and that we're not inadvertently disadvantaged. Same goes with the economy. We have to be cognizant of the fact that the UK economy is not in a good place at the moment. Neither is ours, I hasten to add, but they could be for a lot longer than us, and that will have the ripple effect, as I keep on saying to people. You've got to follow the ripples. The UK will struggle for the short term, and therefore it's in our own interest to sincerely wish them well and hope that their economy picks up quicker than is being projected. Thank you very much, Simon.
Thank you very much.
And now, last but certainly not least, we've got Alex Wotton from Manx Radio. Good afternoon, Alex. Fast am I.
Good afternoon. Our greatest concern that we've been hearing from the public generally is that particularly older and vulnerable groups are still very worried about the possibility of non-quarantined household members spreading the virus from either self-isolating, asymptomatic or incubating infected people. there's been a big call from people to make this stricter, to make the whole household isolate. You said that's not going to happen, but where it is particularly difficult, say if you only have one bathroom and one bedroom in a household and more than one person, would you consider restricting those regulations to start with, just to give some people some reassurance?
Well, Alex, I mean, first and foremost, I do fully understand people's nervousness and being frightened about this. This COVID-19 is a situation we cannot be flippant about, and we in the Council of Ministers have taken this very, very seriously. What I would like to point out and respectfully point out to everyone is that we've been carrying out a patient transfer system. They have treatment in a hospital in the UK, come back and self-isolate at home with their family. Now, that's been going on from day one, and we have not had any cases of infection in the community as a result of that happening. Also, in the early days in March, this is the system we implemented. So we are just going back to a system that we had already implemented and used in March. It's because the UK figures are now at 1 in 3,900 that has given us the confidence to make this step. Now, if we say to all families, you must shut down if one of you goes away on a business trip, then that means other families can't work for 14 days. They could lose their jobs. They've got the inconvenience. The children wouldn't be able to go to school. And when we've already implemented this system and it's worked for us in the past, then it seems a good way to go. Now, however, should there be a serious issue and we have to revisit it, then we will, of course. And I don't know, David, if you want to add anything to that to give as much reassurance as we can.
Yeah, again, just echoing the Chief Minister, obviously we're very, very much aware that there's a lot of people worried about this, that are scared about it. Every decision that we take is risk assessed. If self-isolation in the home is followed correctly, then that risk is minimised. Every decision we've taken around the relaxation of borders has been based on the infection rate in the UK, along with various other categories as well. We are at the moment seeing the infection rate going down. Should that change and our near neighbours go the other way, then there would be decisions that would need to be taken. But at the moment, with the risk profile, we just can't really be locking down entire households. That was okay during lockdown because most people were at home anyway, but there is, as the Chief Minister says now, various imperatives. There are people who would be unable to work, would even lose their jobs over it potentially. And as the Chief Minister said, with patient transfer for some time now, we've been operating the policy where it is only the people who travel that have to actually self-isolate. The people in the household that haven't travelled have not had to self-isolate, and we have not had a single case off the back of that.
Yeah. What I'm happy to confirm, Alex, is that should there be a second wave in the United Kingdom and the figures go up substantially, then we will, of course, review this decision and will change our policies accordingly. Let's hope that's not the situation. But as I say, this is something we've done before on the island and we have been currently doing throughout for our patient transfer without any spread. So I hope that reassures people. It's a fine balance. We've got to protect the health of the nation. We've also got to get the economy back on track, because if we haven't got a successful economy, we've got no income to fund our health service, all the services that government provides. And the last thing I want to do is not to have the money to say help with cancer treatment, and then we could lose people's lives as a result of not being able to give cancer treatment. So it's incredibly finely balanced. The Council of Ministers, Minister Ashford and myself, we're juggling an awful lot of plates at this moment in time, trying to get that balance right. We think we've done our best with medical backup and support that the medics have supported this move. But obviously, I do understand how concerned people are. It's a worrying time, especially if you're shielding. But we think we can do this as long as people respect the 14-day quarantine. And that's why I laboured that point in my speech at the start, to get over the seriousness of you don't just come home and mix with the family. You stay in a separate room. You wear masks and gloves. You wipe down if you're having to share a bathroom and a toilet, etc. And your next point.
You mentioned this afternoon that there will be checks by phone and in some cases in person. Can you tell us who's going to be responsible for that? Would it be the police or government?
It will be government. Our borders team, which we've now set up, they've been doing the live testing, obviously, of the IT system for getting your special number when you get a permit, when you're leaving the island, to enable you to come back. We will be employing people to go and do spot checks at people's houses to ensure that they are where they say they are. Well, and we're doing that because it is so serious that if people follow the 14 days, they will not be a threat to their neighbours and their loved ones and the rest of the people of the Isle of Man. It is really important that people respect the fact that we as a government have made these changes to give people more freedom, but it will only work if people respect the 14 days quarantine. And if they don't, there are serious repercussions of a significant fine of up to £10,000 or imprisonment or a combination of both if they break this. And spot checks will be done because we want to protect all of the people of the Isle of Man. Thank you very much, Alex. Okay, well, I think that's everyone for today. I'd like to thank you all very much for your questions. It's good to get that messaging out there to what our people are asking. And I know there's an awful lot of concern, but we're doing our utmost to make sure that everyone is protected. But we have to open the island up. It's a step-by-step approach. It's not a sudden opening up. We're being as sensible as we can about protecting our people, but without causing our economy to crash and burn, which would be a second disaster. So it's a fine balance, but we will do our best. We, of course, listen to your concerns, and if anything we can do to reassure you, then we will do. Now, in ending, I would like to pay a special tribute to the coronavirus testing team at the grandstand. Now, the original squad, affectionately known as the Swab Squad, will work their final shift together this Saturday. The squad officially opened the doors on the 20th of May, and I'm sure we will all recall the intense interest this attracted at the time. Large numbers of people in cars descended on the drive-through facility, a sight the island has never witnessed before. A total of 47 staff have worked there over the months, many of whom were student nurses. Now, unit coordinators Amanda Phillips and Bernadette Devlin tell me that they were nothing short of amazing. It has certainly been a hands-on training experience like no other, one which will be invaluable to the next generation of nurses as they start their careers. Amanda and Bernie also want to convey thanks to colleagues from other areas who contributed to the success of the project and made their lives so much easier. Staff in microbiology, the 111 call centre, as well as portering, catering and laundry staff from Nobles, and I know there was a number of teachers from UCM who went there to help as well. So thank you. You showed what teamwork really is. What I think is particularly impressive is that despite COVID positive patients attending the unit from day one, not one of the staff contracted the disease. From Monday onwards, the facility will be run as a community swabbing centre, mainly handling tests for pre-operative patients, and this is a vital safeguard against infection as routine work resumes at the hospital. The team will continue to take samples from any symptomatic patients too. So Saturday marks the end of an era, and I want to thank all involved for the immense effort, dedication and commitment given to the project. You have played a vital part to our COVID-19 response, working long hours in challenging circumstances. You did your jobs with professionalism and pride and helped the community through a scary time. It is my pleasure to thank you and all health and care staff for your service to our community. We may have stopped clapping, but we haven't stopped appreciating our NHS heroes. Finally, before I exit stage left, I would like to say happy birthday to our precious Gaiety Theatre. The Gaiety Theatre opened its doors 120 years ago today, and I called in earlier to join staff and supporters marking the occasion. The theatre has been closed during the pandemic, so they found another way to celebrate. A diverse range of memories have been sent in by the public over the past few months to form a unique online collection. It includes pictures, programmes, anecdotes and reviews reflecting the Gaiety's colourful past, from the Young Farmers concerts to drama festivals, and from plays, ballet and opera to stunning performances by local groups. The Gaiety has a prized place in Manx community life. The collection is still open if you have something to submit. Do visit the site at villagaiety.com/memories. Many happy returns to the Gaiety. May the curtain continue to rise for another 120 years. It's good to finish on something so positive. Have a good weekend, everyone. Thank you all very much.